Well, hello everyone. I want to continue my lecture on this material on how we treat abnormal behavior. And hopefully, if you've given any thought to becoming a psychiatrist or a psychotherapist or a counselor, uh, you know, you pay particular attention to some of these techniques. I do caution you that if you are not going in this realm, you want to be a little bit careful before you start trying to do therapy on your friends and things like that. That can be very, very dangerous in that regard if you don't know what you're doing, what you're looking for, and so on. If you haven't already, please watch the lecture video, which is an introduction to therapies, as well as a discussion of sort of the first of the Freudian approaches to psychotherapy. All right. And the history of therapies was mentioned in there before. Now, I want to get into some different types of psychotherapy, and that is what is called humanistic and group therapy. So let's get started. When it comes to treating individuals in a therapeutic setting, there is what is called the humanistic approach. This was originally developed by a man named Carl Rogers. And Carl Rogers, really, for what it's worth, was pretty much a complete opposite of the Freudian psychotherapy approach. If you remember from before, the Freudian psychotherapy approach basically would delve into your unconscious, and then once it did, you would be told what your problem is and what you need to do to fix it. Okay, it was the Freudian approach was very therapist driven, very therapist driven. Carl Rogers absolutely disagreed with that. To him, the therapy should center around the person, not what the therapist wanted, but let the client or the person determine where things were going to go. In his approach to therapeutic treatment, very person-centered. The client or the person would be allowed to pick the topic. What are we going to discuss? Very non-directive. The Freudian approach, by contrast, would get very specific. Tell me about your childhood. Tell me about your mother. Tell me about your upbringing. Here, it was more of let's talk about what you want to talk about. And that's the idea. The client does pretty much all the talking, and the therapist is just listening. Now, that doesn't mean the therapist does nothing, but the therapist is just listening. And so that is a big, big part of it. Okay. So I'll explain here shortly what it is the therapist does. The idea, and I'm going to back up here real quick, the idea behind the humanistic approach is that you let the client or the individual come to the realization of what the problem is and the solution all by themselves. It's not here, but I want you to make note of that. The goal is to let the client or person, same individual, come to the realization of what the problem is all by themselves. That is the idea. Okay, that's the premise. If you use a Freudian approach, and the psychotherapist using a Freudian approach tells you that your problem is this, and you're hiding this in your unconscious, and you're relying on these defense mechanisms, and you need to stop doing that. You might walk out of a Freudian psychotherapist's office thinking, well, that's an hour of my life I'll never get back, and $75 I'm out. With the humanistic approach, if after time you turn around and say to oneself, I guess my problem is this, and I guess what I need to do is that. Well, you've said it yourself. The therapist would look at you, the humanistic therapist would look at you, well, you said it yourself. Yeah, I guess I did. There's no denying what the issues are, because you were the one that came to the realization of the problem and hopefully the solution as well. So what does a therapist do when you use a humanistic approach? Okay, there really are four things that a good humanistic therapist does. And some people can do this too when they are just around friends, but I really warn you again, don't start trying to do therapy on friends. I really do mean that, okay? I think good friends do this sometimes in just listening to other people, but let me show you what I'm talking about. A humanistic therapist, as he or she sits and listens to a client, will at times turn around and use what is called reflection. Reflection is a process by which you repeat back to the therapist, you repeat back to the client. The therapist repeats to the client what they've just said. Make them aware of what they've said, and sometimes close to the same words that they just used. So if a person were to come, let's say you're the therapist and I'm your client, and I come in and say, and I'm just making this up, I say, I'm having some problems with people paying attention to me, with listening to me. They don't seem to trust me, and I don't know what to do to fix that. And you say, well, so you're telling me people don't trust you? No, you repeat it back to me. You reflect it back. You make me aware of what I'm saying. That's the idea behind reflection. You make me aware of what I'm saying. Because maybe I'll say, well, it's not a question of trust. It's that sometimes I don't think they're listening because, I don't know. I try to act silly and I like to see people laugh and smile. And I guess that maybe, because I try to be the funny guy all the time, that people don't take me serious when I do want to tell them something of importance. And then you reflect it back. So you think it's really more a case of not being taken seriously because you spend so much time trying to be the funny person. And you may go, yeah, that's it. Well, see, you turn the direction. By reflecting it back, you made the client realize that there's something else there. Make them aware of what they're saying, because sometimes they'll say something of great importance and they don't even realize they've done it. Okay? No matter what you hear the client say, no matter how silly or irrational it may be, with the humanistic approach, you always remain positive. Okay, you always remain positive with the client. That is the idea. So, for example, if you were to hear something that just seemed awful silly, I think my friends, don't ask me to join them because they think that I'm really just a dumb, idiotic person, and I'm not. I'm trying to make a difference. You stay positive. You don't want to tell them anything negative. Well, stop acting so idiotic. You don't tell them that. You might even see that they're doing that, but you don't tell them that. You stay positive. It's important to be liked by friends, isn't it? Yeah. It's nice to be able to be invited out. You want to be that, don't you? Yeah. The idea behind unconditional positive regard is that if you stay positive, you don't criticize, you don't make fun of, you don't mock or anything like that, it will keep the client talking. And that's what you want to do. You want to keep the client talking. You want them to come to the realization of the problem and solution all by themselves. If you were to turn around and say, well, if you'd stop acting so gosh darn silly, then maybe they'd invite you out more, person may shut up. They may go quiet. You sort of embarrass them. You sort of attack them. They may go, okay, and then they don't say anything else. And well, now you've failed at what you were trying to do. The idea here is to stay positive no matter what they say so that they keep talking. As you're staying positive, you want to make something of an emotional connection. Okay? Empathy basically means that you want to turn around and try and make that emotional connection. You're listening to what they say, but you're also, by your actions and the way you present yourself, you really do care. Because when people feel that others truly care about what they're saying, they're positive and they really do care, that's showing empathy. It will keep people talking. Now, Carl Rogers, way back when, some 35, 40 years ago, would actually sit with a client and sit up very close and possibly put his hand on somebody's shoulder. He might turn around and hold someone's hand, to show empathy and caring and concern like a real close friend. Some have argued that in today's world, that kind of physical contact would make people uncomfortable, and they might be right. But back then, you wouldn't think twice about it. It's a sign that someone truly cares. So, maintaining eye contact, nodding your head, acknowledging their emotions, those are forms of empathy that can definitely be of value. And the last thing you got to do is come across as realistic or authentic. It is vitally important that you don't come across as a fake. Oh, yes, I care about you. The tone indicates some sarcasm. Oh, sure, absolutely. It's fine to be silly all the time, when people can read through that. You have to be positive. You have to, be emotionally connected, show that you care, and you have to come across as very believable. You have to be have authenticity. You have to be believable. The idea behind this is that if you do all these things, as I said before, people will explain their problems and the issues at hand and come to the realization of what's going on. Okay. Now, the biggest shortcoming of this approach, this humanistic approach, is time. Okay. One, it's very hard to scientifically study its effectiveness, but it also can be very time consuming. So there's two things there: scientifically studying it for effectiveness, and two, a person could have multiple sessions, and you as a therapist might, in the first session or two, you might be aware in the first 10 minutes what the problem is and what needs to be done, but a person may go through multiple sessions and never hit the right realization of what the issue is at hand, and that can be a part of the problem. Then there is what we call group therapy. Group therapy, give you a little history here. Group therapy actually began after the First World War. That was called the War to End All Wars, World War I, approximately 1915 to 1919. That was not the Nazis. That was the German Kaiser and things of that sort. And it was a horrible war where soldiers turned around and fought a trench war. They had dug trenches, as you see there. Basically, a lot of times you would look up and 500 yards away or 200 yards away was a trench line of the enemy. And if you stuck your head up at the wrong moment, they could turn around and shoot you and kill you from a long distance. In fact, if your best friend died, there was not time to go bury the body. There was not time to turn around and take a break. Sometimes your friend's body, their corpse, got mixed in with the sandbags, so that it would take any future shots, and you could sort of look, up that way and let them, unfortunately, since they died, and the body would decay. But that way you could look and see what was happening, hundreds of yards away. And being in trenches in Europe would fill with water. There was what was called trench foot. There was disease. It was horrible. And a lot of people came back with an awful lot of issues. All right. If you were to treat, as a psychiatrist or clinician, individuals suffering from post-traumatic stress disorders or things like that, if you were to treat them one-on-one, the best you could do is help anywhere from 4 to 6, maybe 7 people a day. And because you need some time to do your paperwork and write everything up. And so it wasn't very effective in that regard. Group therapy actually was created as a way to be more efficient. If you could bring in, 3 or 4 or 5 or 6 people, 7 people who all have the same issues, and you had 3 or 4 groups a day, sometimes, or more, you could turn around and help out, 20, 30 people a day in essence, as opposed to just 3, 4, or 5, okay? Or 6 or something like that. Another aspect of group therapy is that sometimes some of the best therapists are other clients. We've seen this in many different ways in different realms. In fact, one of the things that we've seen it in that's very fascinating is the treatment of eating disorders and things of that sort. There have been instances, as I've been told, where you get someone in for an eating disorder and group therapy, and the therapist can talk about things, but if they've never suffered from bulimia, a new client with an eating disorder doesn't pay much attention. However, if you hear someone in the group start to describe their situation and what they went through and their thoughts and how they would lie so much to hide what they were eating, sometimes the new client starts to open up. Oh my God, you're describing my life. You're describing my life. That's exactly what I went through. How did you fix it? And here you are, the therapist, allowing other clients to talk and explain their ways. And sometimes that ends up making more of a difference than anything else. So this is sort of what we call the patient-client benefit. Sometimes the best therapists are other clients because they've gone through what you've gone through, and so we tend to listen to them a lot more. Now, there are different types of group therapy. One is what is called family counseling or family therapy. I've been told that there are times that you can work with, say, a child that is showing a conduct disorder or obedience defiance disorder or low self-esteem issues. And you can work with them as a therapist one-on-one for an hour. And by the end of the hour, you've done role play and all that, and they're showing marked improvement. Okay? And you go, hey, that's great. And then they come back a week later and they're right back to their same old problems. They're right back to the same old issues. Okay? It's as if nothing ever changed. And the problem is not just the client, maybe the child, but also the fact that other siblings, brothers and sisters, even mom and dad are doing things to fuel the dysfunction. Family therapy and family counseling is based on the premise that not only do we work with maybe, let's say, the child who has an issue, but we also work with the child's brothers and sisters. We work with mom and dad, things like that, to teach them what to do and what not to do that triggers these issues and these problems. Okay? Family therapy and family counseling, same thing there. This term has probably been thrown around, but you need to know it, and that is this. You're only going to get better if you want to get better. You probably heard that before, and the truth of the matter is that really is the case. Okay, you're only going to get better if you want to get better, and sometimes there are issues where I know of friends of mine who have done family therapy. They work with a child who has got issues such as what I've described: obedience, defiance disorder, conduct disorders, low self-esteem issues, things like that, and the parents refuse to take part. He's like, just go fix my kid. You know, they're the one that's all messed up, or other colorful vernacular. If a parent doesn't want to be part of it, they're not going to get better. And the idea that maybe they're part of the problem, they fight and so on. So this can be very, very hard. It's not impossible, but it can be very, very hard to deal with. Right along with this is the issue of marriage therapy. The numbers vary at times, but what we sometimes hear is that approximately 50% of the people who tie the knot and get married untie the knot. You know, for some people, it seems that we're going to live happily ever after, or until the first fight. Okay, till death do us part, or until our first disagreement, at which point we're going to go our separate ways. There are a lot of different techniques that can be talked about with marriage therapy, but basically it boils down to the same thing. If one person doesn't want to get better, if one person is unwilling to do this, and sometimes it's because they fear that they're going to realize that they're part of the problem, and they don't want to see that. So they'd rather their marriage go down the drink, down the sewer, than admit that they might be part of the problem. But basically, there's nothing you can do in that regard. If people are willing to make a difference, if people are trying to save their marriage and things like that, some call it relationship therapy, then yes, then things can get better. I will say this: if you become a marriage therapist, if that is something you're actually considering, by the time they usually end up at your door, things are bad. Okay, they do not come to you with the very first fight. Usually they come to you and things are in pretty bad shape. Now, that doesn't mean you can't fix them, but they can be quite the challenge, to say the least. Okay? All right. Know that all of these, group therapy, humanistic therapy, and even the Freudian therapies, are called insight-based therapies because they try to give you an insight. All right, I don't have the term on the slide, but I hope you make note of that. These are all insight-based therapies because they try to give you an understanding via the group. They try to give you an insight into your unconscious. They try to give you an insight by letting you come to the realization on your own, okay? They all fall into this one category. In another lecture, you're going to see where there's a totally different approach to these things that we need to address. Okay, that's enough for now. Take care.